Right, the meeting's now live.
Good morning. Welcome to this morning's Health and Wellbeing Board. My name is Councillor Lee Chapman. I'm co-chairman of the board, and I'm obliged to inform you this meeting is being live streamed and recorded. Members of the public will be able to hear the audio of the meeting and view the papers on the screen. Myself and co-chair Dr. Julian Povey would like to acknowledge the incredible work that has taken place across the NHS, local authority, community and voluntary sector and other organisations during the coronavirus pandemic. The local system response has been amazing, demonstrating excellent partnership working, and we congratulate everyone involved. We also recognise the tremendous effort Shropshire people have played in supporting those in our own communities. This is also a time to remember those who have lost their lives during the pandemic and the deeply sad impact this has had on their families and friends. We offer our deepest sympathy to them at this time. I will now explain that this meeting is being held using remote technology, and should any committee members experience technical difficulties during the meeting, and we have had some of those, they should immediately contact the designated IT officer on the number they have already been supplied with. Everyone is requested to mute their microphones unless asked to speak. Please only use the chat function to indicate the desire to speak. Do not use it for anything else, so that it is clear who is asking to speak and the debate has to be heard by those listening to the audio feed. As chair, I will interpret the council's existing standing orders in light of the requirements of remote participation, with advice from the monitoring officer prior to making a ruling. At the start of the meeting, I will ask members of the board to confirm their presence and any disclosable pecuniary interests they may have in any of the items on the agenda. I will ask anyone that speaks during the meeting, including members of the committee and officers, to introduce themselves each time before they speak. This is so that those listening know who is speaking. So I'd now like to do a roll call of the members of the committee, and I would remind members that if they have a disclosable pecuniary interest in any of the matters to be discussed, which is not included in the register of interests, then they will be required to leave the meeting prior to the matter being discussed. I will now read out each member's name and ask them to confirm their presence and confirm if they have any interest. I'd also remind you that you'll need to unmute your microphone before you speak and remute it once you have done so. So if I could start, Councillor Dean Carroll.
Present, thank you, Chair, and no interests to declare.
Lynn Corley.
Present, Chair, no interests.
Thank you. David Evans.
Present, Chair, also the Accountable Officer for Telford and Wrekin CCG.
Thank you. Jackie Jeffrey. Okay, we are not showing Jackie Jeffrey on our list, so when you can join us, Jackie, just let us know. Dr. Julian Povey.
Present, Chair, and no interests.
Thank you. Councillor Ed Potter.
Present and nothing to declare.
Rachel Robinson.
Present and nothing to declare. Thank you.
Okay, and other members who are present at the meeting, if I could just ask them to introduce themselves Claire Featherstone.
Good morning. Yes, Claire Featherstone, Culture and Heritage Manager.
Thank you, Claire. Gordon Kachane.
Good morning, everyone. I'm Gordon Coshane, Public Health Consultant.
Jo Robbins.
Morning, everybody. Jo Robbins, Public Health Consultant.
Maggie Bailey.
Good morning, Maggie Bailey, Interim Chief Nurse at Shrewsbury and Telford Hospital, representing Louise Barnett, Chief Executive.
Thank you. Nikki Jakes.
Good morning, everybody. I'm Nikki Jakes, Chief Officer at Shropshire Partners in Care.
Thank you. Paul Bowyers.
Hi, I'm Paul Bowers, Head of Operations at Midlands Partnership Foundation Trust, and I'm representing Cathy Riley, Managing Director today. Thanks.
Thank you, Paul. You're very welcome. Penny Basin.
Penny Basin, STP Programme Manager and Communities Lead.
Thank you. Ros Preen.
Good morning. Yes, Ros Preen, Director of Finance for Shropshire Community Healthcare Trust, and deputising for David Stout this morning, and nothing to declare.
Thank you. Tanya Miles.
Good morning all, Tanya Miles, AD for Adult Social Care and Housing at Shropshire Council, and I'm here for Andy Begley, Director of Adult Social Care, Housing and Public Health.
Thank you, Tanya. Tim Ward. Tim's here.
Committee Officer.
Thank you, Tim. And Val Cross.
Hello everyone, Val Cross, Health and Wellbeing Officer, Shropshire Council Public Health.
Thank you, Val. We wouldn't be here if it wasn't for all your hard work. Thank you. Excellent. Right, so item 2 on the agenda is disclosable pecuniary interests. We've dealt with that during that initial roll call. Item 3 of the agenda is the minutes, and these were held in a strange time when we really didn't know what was going to happen to us. The 5th of March 2020. I'd like to propose, I've had one amendment which I've been notified of, in that we missed Tanya Miles off the list of attendees. We'll make that adjustment. I'd like to move that the minutes held that were circulated are signed as a correct record. Before I do that, would anyone like to indicate using the chat feature that they would need to make amendments to those minutes? Okay, so could I have someone second the minutes, please?
Chair, it's Julian Povey. I'll second the minutes.
Okay, thank you, Julian. So I'll accept those as a true record, and I'll arrange for those to be noted as being signed. Thank you very much. Item 4 on the agenda is public question time. We have had no public questions received today, so I will move on to the next item. Item 5 then is the STP update, COVID-19 restore and recovery. I understand that Steve Trenchard is going to take this paper. Steve, could you introduce yourself and take us through the item, please? It's that scary silence when nobody appears to present the item that makes it difficult. I haven't got Steve on my list.
Steve's having difficulty with IT at the moment.
Okay, that's fine then. So we will progress to the next item on the agenda, and we'll move on to agenda item 2, which is the community resilience team. I beg your pardon, agenda item 6, but it's the second substantive item, which is the community resilience team. Superb report that's been submitted. I'm very pleased to introduce Penny Basin. If you could just say hi and present the item for us, please, Penny.
Yeah, thank you very much, Chair. I'm really disappointed because quite a bit of effort has gone into developing a video to play you today. It wasn't a long video, it was a short one from our community reassurance team, and we just haven't been able to download it to show it to you. So it was sent in various forms over various days, but something got lost in the ether, and today is just not our day. So I'm sorry about that. I would like to share it with the group another time if I can, or after this meeting. Because it just kind of shows the enthusiasm and interest in the way in which we worked during pulled together as a kind of partnership across directorates in the council, and certainly with our partners in the community, to support people through the scary particularly the initial scary times of COVID. So if I just highlight some key parts of the report and take it that people have had a chance to read it, and then if I can ask after I've done that, my colleague Claire Featherstone, who was certainly working with me amongst others to develop the kind of community response to COVID. So you'll see in the report we had various strands to the work. We recognised very early on that that communities were going to need support, but we also, through COVID, but we also recognised that communities themselves were pulling together and providing that support to each other, which was absolutely fantastic to see. And I guess as the local authority, we were very keen to make sure that those people who were pulling together to support communities had the support that they needed to be able to do that. So we started off very early on with pulling together a resource pack for community groups to work through around keeping themselves safe, keeping others safe while they were helping each other in communities. We also pulled together community reassurance teams. So those teams were working in the localities in the 5 areas of the county: northeast, northwest, central, southeast, southwest, in a kind of with a team leader for each area and a number of redeployed staff from across the local authority to work to support those community groups and to understand what those communities needed through COVID. And of course that challenge was even greater because people were doing this all online for the most part anyway. So those teams helped hundreds of people, but understood very quickly that there hundreds of community groups were pulling together to help people, and we were able to map those community groups, put them onto a Power BI report that our customer services, who have been a real strength in delivering this approach, were able to use. So we've got hundreds of community groups mapped, but as well as businesses and others of other businesses of interest for communities to help them. So we have over 600 600 businesses and community groups mapped for communities to be able to utilise and understand, and that mapping and that tool is available online for anyone to use. But certainly our customer services at the end of the phone in our phone line were able to use that tool as well to understand when people phoned concerned, needed something, that they were able to use that. Another key strand of the work was food. So I suppose we all recognised that with people not being with shielding, so we have over 10,000 people in the county shielding, and on top of that a number of other vulnerable people who were self-isolating, that they would need access to food, medicine and other items. And so the government have implemented a food delivery system where once a week, if someone's shielding and they need that, they receive a food box. But there were gaps along the way, and there was a number of weeks before that system could be implemented. So we picked up the mantle on that as well and delivered to over, I think, about 960 homes have had, and over 2,500 people have had food boxes from us. And on top of that, there's a cohort of homeless people as well who receive weekly food boxes with that team making that delivery alongside Shire services, as well as hot food daily. So there's a huge amount of work going in from across the local authority and our partners to keep people well. Safeguarding strand was implemented to make sure that all of our partners and across the local authority, we understood that we still had a role to ensure people were safe at this time, and that was and reaching out to people to help people know what to do if they came across something that they thought wasn't right. So that was a key issue for us as well. We implemented my words have gone, a small grant program for community groups to help them, and for community town and parish councils running community services for them to help them as well. So that was a key element of the work. So I'll just pause there. I think, well, before I do that, I think what I'll say is the mental health we pulled in as part of under that banner so that we could put across the work and working out into communities, that we could sort of smooth the way for the communication around our mental health support and our mental health resource that we put together. But I won't steal the thunder from our colleagues Gordon and Joe, because they've done some amazing work and they'll report on that afterwards. And I think the only thing left to say, and Claire will be able to do this better than I can, but the amazing approach, I suppose, of our staff and partners has just left us with a lot of learning about how we can work together and what it means when we're sort of given that latitude to just get on and get the job done, and how we pulled together and delivered that. So those are some really positive. Claire, do you want to say a bit more about that?
Yes, thank you, Claire Featherstone, Culture and Heritage Manager. Yeah, I mean, this has been a remarkable experience, I think, for all involved. I have been completely blown away by staff from Shropshire Council and from the NHS and other organisations who have just got on with this, you know, and it's been fantastic to see the results and the way in which those people have been working together. I think it gives us a lasting legacy that will make a difference going forward. A lot of the staff involved with the community reassurance team and the food hub were from the community, from the culture, leisure and tourism teams. Obviously, we had most of our venues, well, all our venues closed from the end of March. And they now have an understanding of the vulnerable in the community, our social care system and public health, that they would never have had otherwise. And I think it's really embedded a lot of health and wellbeing objectives and learning into those staff, along with other staff from across other parts of the council. And you know, I'd just like to sort of personally recognise the contribution of the staff, and to thank Penny, who's been an absolute star in all this to make it happen. It's been a really rewarding experience.
Thank you, Claire.
Sorry, I said I wouldn't say any more, but actually just a couple other things. Well, thank you for that, Claire, but I think back at you. So there's been a real effort across the whole board from a management team that we pulled together and made them meet nightly at 5 o'clock to make it happen. So bless them. But there's a couple of stories that were just lovely about the whole thing. So one, and I don't have, do you have Rick's words in front of you by any chance, Claire? Because if you can give those. But another one was is just our staff. So one of our staff members from Claire's team, one of Claire's outdoor partnerships team, when this item came to scrutiny and there was thanks given, and I passed that thanks on down through the teams. The response that came back was that it was the most rewarding work of their lives. And I think that for me, that absolutely said it all. So, and we have another staff member who works in the theatre. His name's Rick, and he started out March, I think, kind of thinking about this year's panto, and he ended March by, you know, working out in communities and understanding what, you know, so his work and his life changed significantly from one end of the month to the other, and his willingness to just get completely stuck in was amazing.
Yeah, I've got the feedback from Rick Turner, who's one of our theatre technicians at Theatre 7, who volunteered really early on to get involved with this, and he says it was a huge boost to my morale to be contributing to such a worthwhile project. And it made me aware that while the council was providing a backstop of care, the Shropshire communities were rising to the challenge of looking after themselves. Working with the CRT has allowed me to move from a despairing start to the lockdown through building a new set of skills to being pleasantly surprised by how resilient our communities are. I started the year flying a magic carpet and dancing in an elephant costume, and yesterday completed a course in psychological first aid, adapt and survive, keep bouncing forward.
Great. So, colleagues, around the virtual table, I haven't had any notes of anyone wanting to speak. Does anyone else want to add to this? From my own perspective, from the chair, I thought the report was superb. I thought it really demonstrated the capacity within our communities in Shropshire and the way that the organisations rose to the challenge and continue to rise to the challenge as we go forward through to recovery from the pandemic, hopefully with as few aftershocks as possible, although I don't think that's by any means certain, but nevertheless, we continue to be hopeful that people are responsible in their behaviour and that we don't see an upsurge in cases across Shropshire. I think it's very interesting reading the appendices and looking through to some of the telltale pointers. And I'm particularly pleased that we're featuring the paper today from Gordon and Joe about mental health, because some of the issues that arise naturally from that, both from a positive perspective and in terms of some of the challenges, lead on nicely to that paper. So I'll look forward to that shortly. I do think that I do wonder when we look at the amount of information and the amount of data and the way that we've been able to find some of the cracks in the system and stop people falling through them, to what extent there is a smarter solution across Shropshire for us to be able to share resources with the community and voluntary sector on an ongoing basis about those people who are vulnerable. And the potential for all organisations operating in that space to have sight on individuals so that they don't fall off again. And I just wonder whether or not that's been part of our thinking in terms of how we'd seek to provide a space where that information could be kept up to date and those individuals' progress could be monitored without the need necessarily to go through a formal clinical pathway in terms of clinical records. But I think it's something that we need to give some thought to what extent community and voluntary organisations already keep records on those individuals, and to what extent there's some wider learning from that. So I've had a request from Rachel to speak. So Rachel, over to you.
No, thank you. I mean, I think a lot of it's already been said, but I think I just want to say, obviously, a very personal thanks to everybody, really, both our communities across Shropshire and to the team who have pulled together from a standing start to deliver what's been a phenomenal piece of work, and it continues to be, I think, as you've said, as we move forward through this, the sort of bedrock of how we support our communities and support our most vulnerable. And I think that as we've said, everyone said it, there's so much to learn, that collaboration and the way that our communities have worked together. It builds on the things that we were talking about as a health and wellbeing board at our workshops back in September. That community resilience, the importance of our communities, all of this has come to fruition, I think, through this. So I think it's just to highlight that, to give thanks to our communities, and to give thanks to the team who have done a phenomenal job in responding to all of this. We knew that this would be absolutely crucial. We have, and we'll come to that, and the paper highlights it, we have significant number of vulnerable communities across Shropshire, not just clinically, but also in terms of the inequalities and the makeup of our communities and so this work is absolutely important for us to make sure that we reach out. The role of the voluntary sector has absolutely been crucial instrumental in this. And so it was really to highlight that, but also to link back to the work that we set out in our workshops at the start of the year. And I think it's going to be a crucial part of the plan that we're coming on to going forward as well. And just to say a personal thanks to everyone.
Thank you, Rachel. Rachel Robinson, our Director of Public Health. Could I introduce Councillor Dean Carroll, Portfolio Holder for Adult Services and Health. He wanted to speak next. Dean.
Thank you very much, Chair. Also, as well as being Portfolio Holder, or predominantly, I'm also a local councillor, as are you. And I'd like to give thanks and pay a tribute to the local community reassurance teams specifically, who have been real game changers on the ground, as I said, specifically in the early days, but they continue to play a valuable role. Some of the fantastic community-based work and volunteers that have sprung up as a result of this wouldn't have been able to have been as well organised and directed if it wasn't for their work. So thank you to Penny, to Claire, to Kate, to Sean, who runs the central area one, and to all the team. They've done an absolutely spectacular job.
Thank you.
Thank you, Dean. Okay, so I haven't got any indication of anyone else who'd like to speak. Actually, Ed, introduce yourself.
Hi, hello. I would just like to just second what Dean has said I'm the portfolio holder for Children's Services, but also mainly as a local member, elected member, out and about in the communities. The advice and information that we've been sent, that we've been able to field to our communities, has been invaluable. So I think from a local level, and I know my parish councils, I live and represent a very rural division. It has been very much appreciative to have that communication, but also from the portfolio of Children's Services perspective as well, young people and the impact on young people we all know about, and I'm very grateful for all the work that's been put in by all services across Shropshire.
Thank you, Ed. Right, I've got no more indications. The recommendations from that paper were that we note the work and that we continue to learn from, I've got it here, note the good work of public sector and community sector colleagues to support people during the COVID-19 pandemic, and also to endorse the considerations for the next phase of the community response to COVID. So I would ask board members if they are unhappy with that recommendation to indicate. I think that's very unlikely, but thank you to board members, and we will take that recommendation forward and continue to support the ongoing work through recovery. Thank you. So we will now drop back to agenda item 5, which is the STP update, COVID-19 restore and recovery. And I'm very pleased to say that unfortunately, in the absence of Steve Trenchard being able to join us, not through lack of will, but through lack of appropriate technology, David Evans has agreed that he will take this paper. So if I could introduce you, David, or if you could introduce yourself and take us through it, that would be great.
Thanks, Lee. Very poor substitute for Steve Trenchard, I have to say, so I'll do my best. I am David Evans. I'm the Accountable Officer for Shropshire CCG. Mindful, of course, that it's sometime because of circumstances since we had a health and wellbeing board. So I probably want to recap a little bit on exactly where we've been over the past 3 months in terms of COVID, as well as the plans now in terms of restoring services. Clearly, we have seen an unprecedented situation in terms of what's happened across health and social care over the last 3 months, and I would like to say right at the outset how grateful I think all of us are for the enormous efforts that staff at the front line and others, but particularly at the front line across all sectors of health and social care have made in terms of trying to keep our population as safe as possible and care for them as safely as possible in very, very difficult circumstances. And I think I do need to recognise and acknowledge that up front. Clearly, it was a difficult situation. We shut down services very quickly at the beginning across health and social care, particularly in terms of acute services. We rapidly changed the way we delivered services across a whole host of sectors, including primary care, community services, secondary care, mental health, etc. And that does make the whole restoration and recovery piece a very complex, challenging problem for us as we go over the next few months. Clearly, we didn't see the levels of infection that we originally anticipated and the modelling was suggested, but nonetheless, tragically, we have seen a significant number of deaths, as Lee alluded to at the beginning of the meeting, and that is regrettable. However, as I say, it was not as bad as we initially thought it might be, but clearly that's a very, very difficult circumstance for individuals, families, neighbours, carers, etc. So moving forward in terms of where we currently are, clearly we've kept some services going during the pandemic. And those are those essential services. So primary care has continued to function, albeit in a different way. Emergency care has continued to function, albeit it has presented some challenges. Cancer services have continued to function, albeit again there have been some challenges around that. We are now moving out of a pandemic phase into what's called an outbreak phase, although clearly we want to be mindful of any upsurge in infection rates as we move forward, and particularly with winter coming on as well. We recognise that we do want to plan carefully for how we restore services. So we've instituted a framework for restoring services, which meant that any service restoration has to be signed off first by Silver Command and then by Gold, and Gold are the accountable officers, chief officers of the respective health and social care system organisations. So that does include both local authorities as well as health partners. And the reason we've done that in that way is that we wanted to make sure that when we bring services back, we fully consider the impact on partner organisations, on staffing, on PPE supplies, etc. Because the worst thing we could probably do is bring services back in a unstructured, haphazard way that meant that it put additional strain on partner organisations that they were unable to cope with. So we've taken a very, I believe, responsible approach in terms of making sure that there's sign-off at a senior level before services are restored. Included in that sign-off is the impact on other organisations, and included in that sign-off is a review period to see whether or not the impacts on other partners have transpired, or whether there were some that we didn't think of, and what that has meant for the system as a whole. We're clear that we want to try and make sure that in restoring services we do this safely, and that again presents some challenges around social distancing. So to put some context around that, in terms of bed numbers, to be able to adequately, safely maintain social distancing, we model that we lose about 200 beds across the system. Most of those are in the acute sector, but some of those are in community hospitals, and clearly that significantly impacts on our ability to get back to pre-COVID activity levels in the short to medium term. And what I would say, Chair, is my personal view is I think it won't be until certainly late next year or possibly into 2022 before we see activity levels at the level we saw them pre-COVID. And the reasons for that are around the impact of the bed numbers, as I've just outlined, making sure that cases, we've seen significant productivity drops in cases in terms of theatre capacity and diagnostic capacity. Now, we have put a bid in to NHSEI, as all other systems across the country have, to bring modular capacity online to offset some of that. However, given the backlog that's built up over the last 3 months or so in elective care and in diagnostics, I think it will be some considerable time before we get back to normal in terms of both activity levels and clearing that backlog. So we are at the moment looking at continuing using the Nuffield Hospital for elective care and cancers, as we have done during COVID. We are also looking at bringing trauma back from Robert Jones and Agnes Hunt into Royal Shrewsbury by the latest September, although we're trying to do that quicker, and we will then use Robert Jones not just for orthopedics but potentially for some other elective surgery as well, so that effectively we create two by and large COVID-free hospitals and leave RSH and PRH as hospitals for either COVID positive patients, emergency care, or potentially COVID positive patients. So as I say, this is challenging, it's complex. We have a plan in place and we have a clear agreement in place around how we restore services. The other thing I'd say probably though, just in closing, Chair, if I may, is I think one of the things that we've seen over the past 3 months is this system working far more collaboratively and collegiately across health and social care than we've done certainly in the past few years. And I think that's enabled us to respond far more effectively to COVID in very challenging times. And as system leaders, we are all committed to maintaining that new approach to working as we move forward and not regressing into our previous organisational silos. But happy to take any questions, Chair.
Thank you, David, and thank you for stepping in and so ably covering the paper for us. I've got a question to ask, and then if anyone wants to indicate on the chat feature if they want to come in, I'll bring them in. To what extent has the need to reduce face-to-face treatment and assessment of patients, to what extent are we taking forward that different approach that's been forced on us? And is there any degree to which that will reduce the or will free up capacity in a conventional clinical environment as a result of some of the things that we've been forced to do?
The intention of the system as a whole is to make sure that where we've seen clinical change that has worked and been better for patients, has been improvements for patients, we will continue with that moving forward. So we will definitely continue with telephone assessments, video assessments. However, what I would say is there's a balance to be struck, because clearly if I talked about this in terms of primary care as an example, and Julia may want to come in at some point, clearly all practices across Shropshire, Telford and Wrekin instituted telephone triage for all patients almost immediately. Whilst that is good on one level, because it cut down face-to-face contact. It does present a different degree of risk in terms of ability to assess patients. So I have no doubt moving forward, we will continue to see telephone triage, probably for a significant number of patients in primary care. I don't think it will be for all patients in primary care, because we need to make sure that patients are properly assessed in terms of what's going on moving forward. And I think it's about getting the right balance between risk and and using the technology in a different way.
Thanks, David. Julian, did you want to add to that?
I would agree with what Dave said. I mean, I think talking about it from a primary care GP perspective, you know, we are instructed nationally via a sort of a standard operating procedure from NHS England around how to conduct general practice at the current time, and we've been advised to do a triage first model. I think, as Dave said, the problem is it alters the risk balance, and it's also it actually takes longer generally to do consultations remotely than it does face to face. And I think a lot of GPs prior to COVID felt uncomfortable around that risk balance, and I think some people will have changed their view, but a lot of GPs won't have changed, and for a lot of GPs it's actually quite hard doing the telephone or video assessments or the remote assessments via eConsult, which is like an online sort of structured email sort of service that most practices in Shropshire use. So I think it's difficult, and I think we've also still got a chunk of patients who aren't contacting us because they're either thinking that we're overwhelmed and busy, or that they think they wouldn't want to come and see us or come down to the surgery because of the risks of COVID. So I think it's important to get over to the public that general practice and A&E and all our services are open. They're all working in a different way, but they shouldn't sort of be reticent about seeking sort of medical advice if they feel they need it. 111 has tried to move a lot of its contacts online, so we'd encourage people first to use 111 online rather than dialing 111. But obviously people who haven't got access to online or who want to speak to people can dial 111, and they can certainly contact their surgeries. And most surgeries are either accepting telephone contacts or online bookings or online forms such as eConsult that I've already mentioned.
Thank you, Julian. I think, and you know, the Health and Wellbeing Board is a public forum, and I think it's useful, and I think it's right that we take the opportunity in this forum to put exactly that point forward in relation to surgeries, emergency care, and the fact that they are open, because I'm sure that there are people who will, for one reason or another, not necessarily be seeking support early enough to the same extent that we were seeing before the pandemic. And I think the ability for us to make sure that that information is appropriately disseminated is really important. Lynn Corley from Health Watch wanted to come in. Lynn, can you?
Sorry, I've added a comment in the chat bar just to support what. Can you hear me?
But you.
Hello.
Yes, Lynn, I wanted to take the opportunity that because this is a public meeting and people can only hear us, the chat bar is just for messaging, but it isn't that this is a public forum. And so what I wanted to encourage is for the debate to be verbal and not through the chat function. Sorry to be picky, but we absolutely welcome your contribution, I'm sure, from Health Watch, as will those members of the public listening.
No,
so
that's fine. I'm having some technical problems.
That would be lovely. I can hear you very well, Lynn.
Yes, that's great. I'm just having some problems with tech. Oh, can you? That's good, because I haven't got a camera or anything like that. Yeah, it was just to say that I just wanted to reiterate what Julian was saying, particularly about people accessing services, because that was the message that we got through the survey that we completed in April and May, and we're hoping to publish our report today on that. So, for example, we heard that people were not going to their GP practice for the reasons that Julian gave, thinking that they would be very busy, or thinking that they wouldn't be able to see the GP, and other people saying that they didn't want to contact the practice because they would only be offered a phone appointment when they wanted to be seen face to face. So I just wanted to support the idea about the public messaging about how accessible services are. And as a Health Watch, we can't give that messaging without it coming first from the providers of those services. So if they provide us with that information, we will share it through all our channels.
Thank you, Lynn. Ros would like to come in. If you could introduce yourself, Ros, and make your point.
Certainly, Lee. I was just listening in interest to what Julian and Dave were saying, specifically around the technology that we're using to support patient access. So I've just got a comment about that. I know the debate's moved on a little bit more in terms of messaging and the general kind of public messaging, but just to give you some insight, really, from the provider of healthcare point of view, all NHS providers were given immediate access to online video consultation technology that they had been struggling to deploy systematically before COVID. So we've had another sort of part of the toolkit for our clinicians immediately made available on through regional and national routes for us. And we've seen, so I can only speak from a Shropcom point of view, but when we're trying to restore our services now, it's a really important part of what I think will be the future as well, notwithstanding all of the risks and the kind of very measured approach you've got to take to patient access in general, because not everybody will want to or can use that. But I think I'd point to the benefit that it's had for our staff and patients who've been shielding, for example, to provide contact in that way. So we've had staff that have been shielding but have been still able to be clinically operational through that route. So I think it is like everything, it's not a panacea, but it's something that has been an incredible help in the last few months, and something that I know we'll continue to work with. So I just wanted to add a very kind of like positive sort of bit of information on that, just to flesh that out.
Thank you, Ros. Julian Povey, you'd like to come back?
Yeah, just really just to answer Lynn, or to add further information with regards to what Lynn was saying. I mean, I think that we do need to be informing patients that they are, the telephone assessment or online assessment is the way that their initial contact will be for everyone. And I think, 4 months into this sort of period of time, we are getting patients who are saying that they want to be seen, they have to be seen. And I think that we need to be clear that, in fact, to manage the workload, and in fact, general practices are busier than they've ever been. I mean, I think to say, we can't say that we're still happy to speak to whoever wants to speak to us or get in touch with us, but general practice is very, very busy, as are all health services. But obviously, to reiterate that it will be telephone access, the initial contact for most people, and that once they've been assessed, they will be seen in the right environment. Now, we are encouraged that wherever possible, we manage people remotely, and which is where the different risk threshold comes in. But if patients need to be seen, they're broadly divided up into sort of 3 categories: either shielded patients who will be seen in a protected environment, which either be at home, or if surgeries are in a position where they're not seeing the sort of what we call hot patients, they will maybe seen at a given time in a safe environment down at the surgery. Hot patients are ones who have either got coronavirus, or we suspect have coronavirus, or have other problems going on whilst they're unwell with coronavirus, and they're being seen up at the hot site, and that's available at Shrewsbury Football Club for all of Shropshire, Telford and Wrekin patients to access care, and the majority of practices use that for their hot patients. Some practices that are large and have got sort of the right setup are seeing their own hot patients in an environment where they keep those patients away from other patients, which is how hospitals are having to also set up as they move forward. And then the other chunk of patients are people who we have to assume may have COVID, but are very unlikely to, will be seen down in their surgeries, and they'll be seen in a very protected environment, having the doctors and nurses and clinicians wearing PPE, and the patients being asked to to wear face masks. So it is one, just to reiterate, yeah, please, everyone should contact their GP or contact 111 or go to A&E if they have appropriate medical conditions, but that they need to work with us and accept that it will be telephone contact first, which isn't the way that most GPs or most clinicians want to practice, but it is the way that we need to practice at the current time.
Okay, thank you, Julian. Is there, I haven't got any more requests for anyone who wanted to talk on this paper. David Evans, you introduced the paper. Had you got anything more that you wanted to add before I ask the board members to note the contents of the report?
I suppose there's just one thing I'd add, Chair, if that's okay. And Julian's said that primary care is busy, and it undoubtedly is. We have certainly seen over the last probably 4 weeks or so, activity levels beginning to rise across all of health and social care. So if I looked at emergency admissions, for example, the system currently is about 85 to 90% of pre-COVID admission levels into our acute hospital beds. So undoubtedly people are beginning to and have begun to access services again who perhaps had been put off in the first few weeks of COVID, you know, and that's a positive thing, I would say, but clearly there is further messaging we need to do.
Thank you, David. Thank you for presenting the papers. I will take the relative silence from board members as agreement to us noting the contents of the report, and we'll look forward to a further update at our next meeting. The next item on the agenda, item 7, is, we've hopped around a bit here, is the mental health paper. And I'd like to, so the paper is entitled An Update on the Prevention and Resilience Work that has taken place during the COVID-19 pandemic. And I will ask the officers to introduce themselves as they come to speak. Joe, I think probably.
Yeah, it's Gordon here, Gordon Coshane. So I'll start the presentation if that's okay with everybody.
Thank you, Gordon.
Now we have invited some of our key partners to be part of this presentation, and they've been essential in helping drive through the projects and programs that have been going on. So I'll be welcoming those other presenters as we move on. I have had a message from Shropshire Mind from Heather saying that she was having trouble accessing, so I'm not sure if Heather has actually managed to join. If not, I will try and go through her section as well. But Heather, if you are there, if you could let me know, that would be helpful. So thank you, everyone. So if we could move on to the next slide, please. So as part of the community resilience team, the COVID response, we recognised early on that there was likely to be a negative mental health impact for our residents, communities and staff, and that we wanted to ensure that we had representation from across our services and voluntary sector early on to think about what is that impact likely to be, and also to receive that feedback of those who are working with clients and those who are working in services, so we have that direct connection between what's actually happening within Shropshire. So we formed a mental health prevention and resilience group, which would meet regularly, weekly. It was very much action focused in terms of listening to our services, listening to our voluntary sector feedback, and thinking about what is it that are the immediate needs that we need to be responding to ensure that any mental health concerns or emotional well-being worries can be addressed earlier before they become more complex. So we recognised as well that obviously there's a number of different population groups that were going to be impacted, and if we just move on to the next slide, please. So we wanted to ensure that we had the right range of local intelligence. So as I say, using our feedback from partners, the Health Watch survey has been a vital instrument in helping us identify concerns as well, and the interim reports were greatly appreciated. And we also had feedback from our existing other groups as well. We recognised that stress, anxiety, bereavement and grief, trauma and were likely themes that would come through. And also it was becoming clear that there was feedback on impact of people and residents who have previously not had access to formal services. We recognise that the mental health impact of COVID-19 is non-discriminatory and can affect all of us. If we move on to the next slide, please. So I won't go into too much detail as much of this is covered in the report, but just as a flavour of the range of responses, activities and programmes that came out of the Mental Health Resilience and Prevention Group, which was really done at haste. It was very much a case of recognising here is an immediate issue, what can we do, who needs to be involved, let's get it moving. So in terms of having that motivation and connectivity with a whole new network of people, many of which perhaps didn't have the best connectivity prior to COVID-19, were coming together and thinking about what can we be doing to move this along. So what I wanted to do in this presentation today is just highlight some of the key achievements and programs that are being progressed. So as I say, more detail is in the report submitted, but today is a flavour of some of these programs. So if I could move on to the next slide, please. Okay, so one of the first things we looked at was the universal offer in terms of recognising that many people use digital services and the internet to search for information, but that sometimes because there's so much out there, particularly with the response for COVID-19, it would be helpful to have a singular point of access that we can signpost people to a range of guidance, advice, topics that could help people look after their mental health and emotional well-being during COVID-19 and the lockdown, as well as provide a central point for signposting to local support, as well as national advice and support as well. So we put together a document, which is a screenshot here, which is found on our Shropshire Council public facing webpage under the COVID-19 information pages, called Looking After Your Mental Health During COVID-19. As I say, it includes a wide range of topics on local immediate support, various online resources for managing well-being during the pandemic, resources for parents, carers and services, working with young people as well, resources aimed specifically at children and young people to keep them mentally well, thinking about health and mobility in the broader context, and factors such as money worries, which we know also has a huge impact on our mental well-being. Now, we also were aware there are members of our population that perhaps don't have the best connectivity with accessing the internet, or who perhaps don't have online access. So we printed 1,000, I think it was, copies of this resource, which was specifically tailored for people who don't have online access, and ensured to highlight the helpful information for them as well as helpful contact numbers. This was distributed across our rural populations and the other areas and people we knew about who were offline, and that was supported by Shropshire Mind, which has been absolutely fantastic, and we'll come on to more about the work they've been involved with later. If I could go to the next slide, please. Okay, some of you may have heard of the Big White Wall. It's an online, safe, anonymous resource which helps people look after themselves, and it's available any time of day, 7 days a week, supported by trained clinicians online at all times. So this is an offer that the council is currently progressing in terms of providing an offer to our residents. So we're looking at a 12-month license so that any Shropshire resident within a Shropshire Council postcode will be able to access a range of helpful information, tools and resources that can help them with their wellbeing worries and concerns. It also involves a range of courses which look at managing depression, stress and worry, phobias, OCD, etc. So there will be further information about this going forward that's shared, as it's a work in progress at the moment. As I say, we have a range of online resources on the Shropshire Council webpage, and we've been working with the CCG as well, just to identify what the range of mental health local support is. So there is a database of resources on the website that will be helpful for people. If I could skip to the next page, in fact the next 2 pages please, and then one more. Fantastic. So we recognised early on the impact of bereavement for people, unfortunately. Oh, sorry, can we go back one? And working with our partners, we wanted to ensure there is a formalised offer for bereavement support. So not just for people who have been bereaved by a death because of COVID-19, but we recognised that the usual grief and bereavement process has been disrupted due to the lockdown, not being able to access the usual pathways, funerals, etc. But that also previous loss may be amplified and triggered during lockdown. So as of last week, we have launched a new pathway which is accessible via our Shropshire Council COVID helpline, which is, I'd just like to highlight the 0345 678 9028 number. So for anyone who would like access to bereavement support, and it is at no cost to them, also please call that number. This is supported by some helpful booklets which are also available on the Shropshire Council webpage under the bereavement services pages, which provides a compassionate overview of coping with loss and the feelings that may be experienced, and particularly during COVID-19 and lockdown, and how that might differ from usual. And that's supported by a practical guide and checklist based on the feedback we had from registrars and the funeral directors of offering practical step-by-step support of what steps actually need to be taken once somebody dies, and what support is actually out there if you need further advice and someone to talk to. If I could now move on to the next slide and introduce Jo Robbins, who will be talking through.
Thank you, Gordon.
Thank you, Gordon.
Thank you. And sorry, I think it's one more slide after that.
And one more. This is just some feedback actually about the booklets which we have from registrars and some of the nursing staff on the end of life care wards in the local hospitals. They found the booklets really helpful, and have been obviously working with people who have been bereaved, both staff and patients. and we're very grateful that they could have something to hand to people. I'm going to talk a little bit about the Children and Young People's Task and Finish group, which is focusing on emotional health and wellbeing. But I won't talk for too long because I think it's really valuable for you to hear from two of our colleagues that have worked with us on the partnership, Joe Oliver and Heather Ireland, who's representing Clive Ireland today. What I would say, it's been an amazing experience to be part of this group. And it has been very much can do, will do, and we've probably moved things along in 4 months that we would have taken probably 2 years to achieve. And I think that is all credit to the people that have been part of this development. There's 20 people on the call at times, but all taking a role in and recognising the importance of resilience and prevention at this time. So we formed a specific group to look at the emotional health and wellbeing needs of children and young people, local authority focus, because we felt there were some more things that we could do as a local authority to support children's emotional health and wellbeing. Next slide, please. What I would say is that we formed a vibrant and lively group, very experienced people, all wanting to do something more to support children's emotional health and wellbeing. And over the past few weeks, we've had conversations about what's our purpose, what would we like to see done differently. And some of those are some quite strategic changes, and others of them are more practical. There's one not on here, which is really important, and I wanted to flag it up first, really. It's the work around SEND. So we're starting to look at some of the work, particularly relating to emotional health, around the SEND offer. But that particular piece of work is going to be a system-wide approach, looking at personalisation and personal health budgets and potentially how those could support children in the SEND system, who are a particularly vulnerable group that we know need more support. But that's a system-wide. The other projects that you see on here are a mix of training packages. We're looking at something for workforce, because we believe that teaching staff and early help staff, and having had conversations with our Mental Health Partnership Trust colleagues, we're not getting something right in the system here about supporting young people's mental health. And this is the bit before they tip into needing clinical services or CAM services. There's something before that stage. And so we're developing some training to support staff to give them a little bit more confidence, so that children aren't passed between organisation to organisation or across teams and then end up in a system which isn't necessarily the right one for them. I'll talk a little bit about the Leeds University Action Research Project. An opportunity's come our way, really, and we've grabbed at it to look at putting a bid together to support some work with schools. And this is in particular response to the anxiety potentially and children and parents' reaction to COVID-19 and how that's potentially made them feel during lockdown, but how we can prepare them to go back into school post-lockdown. And that research proposal has been worked up by a small team of us locally, but more importantly with a really experienced research team at Leeds University, who have done a lot of work around nutrition, the importance of breakfast clubs, and the links to cognitive achievements and attainments. If we're successful, it will mean it will give us a baseline across all our schools of the needs of children and young people's mental health and their wider well-being. I'll pick another one out from there, which is quite exciting and quite developmental. That's a peer support programme returning for children to school following COVID-19. We feel that's linked to, in many ways, the Leeds University Action Research, and we feel that young people can play a much stronger role in supporting their own peers around this particular area. They influence each other, they use social media in a much better way than many of us can do. So we're looking at bringing in a media student to work with us to look at new ways of reaching children and young people, but also giving out some consistent messages and using platforms that they will relate to. So I won't go into any more detail about those. They're all either starting or they've started and we'd be very happy to share more detail of any of those particular projects that we've been working on. I'd like to introduce you now to one of our team that's worked with us on the Emotional Health and Wellbeing Resilience Group, and that's Jo Oliver, who's played a crucial role in implementing work around staff wellbeing within the council. Could we have the next slide, please? Jo on.
Jo is on the meeting.
Jo, are you ready to pick up this slide?
She's not muted and she's shown as being in the meeting.
Okay. Jo, do you want to start talking to these slides?
I think Jo's having, sorry to come in, Jo's having problems with her microphone by the looks of it.
Is she?
Yeah.
Okay. Do you want me to pick it up?
Yep, if you wouldn't mind. Thank you, Jo.
Okay. I think Jo would obviously talk about this in a different way, but what Jo has relayed to us is the importance of being able to talk openly about mental health and also feeling very much a part of something and feeling really proud to be part of the partnership that's developed around this, but also highlighting the fact that it affects us all, and particularly during COVID-19, all of us have been impacted in some way around our mental health, and being able to openly talk about that has been really fruitful. Next slide, please. So Jo's taken a very pragmatic approach, and in the council, those of you that work in the council will see the YAMA groups, and these have been very well used by many staff members. And the influence of that is that some people don't necessarily want a talking therapy, or they don't want to talk things through, but their pets and their animals are their pets and their kind of solace while they're at home or while they've been in lockdown. And so Jo's created pages on the YAMA group, and people have responded to it, and they found that a really positive thing. So they've had, you'll see the number there, 1,004 responses to this particular group that's been set up. Next slide, please. Val, if Jo can talk, will you let me know? Because I know she'll do these slides just much more justice than I will. Another group that's been set up on YAMA is the photography group. Again, this is from staff members of Shropshire Council who want to get involved in something and share something, but don't necessarily want to make comments about things. Not everybody's comfortable talking or commenting on YAMA groups or discussion groups, and this was a project that was set up to support people. You'll see the number there, almost 1,500 people contributed towards this piece of work, to this project. Next slide, please. The other thing that's happened is that there've been mindfulness groups on this Shropshire Council website where they've shared resources, and people have come up with their own ideas about what they've done. So you'll see somebody there started a gratitude diary. So each day lists 3 things that she's grateful for that's happened during the lockdown, and those kind of things have been openly shared on this platform, which means that people can connect in ways they probably haven't connected to before. Next slide, please. This is the Mental Health Awareness Week. We had an amazing publicity launch during this week and some amazing acts of kindness that went out across the county. You'll see Jo's on this slide. Unfortunately, you can't hear her, but here she is out and about promoting Mental Health Awareness Week down at the Mind offices and also out and about around the county. Next slide, please. This is a mental health and wellbeing weekly podcast, meditation podcast that's been in place, again for staff to be able to log on to on a weekly basis while they're at home and to do something which is a little bit different, which they might not normally find time to do if they're in the office. Next slide, please. This is something that Jo's personally put together, and this describes some of the impact for her of being part of the group and actively taking a role in a new piece of work that she probably wouldn't have been involved in previously. So I'll just pick out a couple of points that she shared with us. She feels she's valued and listened to as part of the group. She feels proud talking about her mental health. This has been able to open up kind of conversations which perhaps she wouldn't have been able to have before. And she's really feels much more productive in terms of being part of a group and getting things done. It kind of reiterates the point that Penny made earlier about the community and resilience teams. She's been able to do more things and has linked to more people than she previously would have done if we'd have worked in the old-fashioned way. Next slide, please. I'm going to introduce Heather Ireland. This is a photograph of Clive Ireland, and that van is called the Donkey, which I at the time didn't know anything about, but it's used by the street pastors to monitor the streets and the nighttime economy at weekends. But this is a van that was used to distribute the leaflets across Shropshire, that we wouldn't have been able to do had we not worked with the voluntary sector and had they not been up for working with us in a really positive and proactive way. Hopefully Heather's going to be able to pick up the next few slides and talk about the amazing work that Mind have been doing over the past few months.
I think you might be disappointed, Jo, because I understand from the messaging that Heather is not able to join us. She's been having some technical issues. We had a message a little while ago and I've not had an update from there, unfortunately. I'm pretty sure that's correct, isn't it, Val? If you could just confirm.
Hi, yes, Lee. I've not heard back from Heather, so I think she must be having real difficulties, unfortunately. So sorry about that.
Jo, should we try and do a double act then on the Shropshire Mind?
Yeah. Yep. Okay, that's fine. We'll pull it all together then.
Okay, if we could go to the next slide. And the next one, please. Yeah. So as I say, Heather and Clive have been doing such fantastic work with Shropshire Mind and supporting us in such a wide range of ways. So hopefully we can do the slides justice. But as Jo was mentioning, and as I mentioned earlier, one of the first things that they helped us with was with the distribution of various literature and our printed copies of the Looking After Your Mental Health resource, but also in terms of distribution of other helpful information, particularly around scams that were likely to be happening during lockdown and other information related to money worries and other factors that could be helpful for people. And that was also distributed working with those who were in temporary accommodation in B&Bs and hotels, etc. So another vital avenue for us to ensure that appropriate information is getting to the people who could most benefit from it. They also fed back that very early on it was clear they were seeing a mental health deterioration for many of their clients, and more people were coming through accessing services that hadn't been using voluntary services for mental health previously. If I could go to the next slide, please. So obviously there had to be some restructuring in how Mind operates, but actually during this time they were able to continue most of the services they're able to offer. So although the drop-in services had to be readjusted and suspended in the short term, the crisis cafes that run on an evening continued, albeit with social distancing measures put into place. Outreach visits were still continuing. We'll come on to the Zoom sessions in a moment, but Shropshire Mind provided video conferencing, anxiety and stress workshops, which were open to anyone who were concerned about their own worries or worries about others. The Sanctuary Crisis Support offer continued, and as I say, there were a large number of queries and calls that came through, over 3,500. If we can move to the next slide, please. So as I say, Mind put together weekly Zoom sessions which focused on anxiety and stress and what that means. What does that, how do we understand that? How does stress manifest, and what does it look like in yourself, and how to recognize it in others? And there have been the feedback, as it says here, has been fantastic, and we'll go on to some numbers and activity on that. And there were bespoke sessions provided as well for various services and agencies throughout Shropshire.
And Jo Oliver would like to add from her perspective that the Zoom sessions were really well received by the staff members.
And I believe details of how to access those Zoom sessions are on the Shropshire Council webpage, as well as from Shropshire Mind themselves. So again, if anyone has been interested, please do look at that information. If we could move to the next slide, please. So this is a flavour of the activity of where the Zoom sessions were provided. So as I say, there were dedicated bespoke sessions held for the hospitals, for the care sector, for the council, but predominantly the majority were open sessions where anyone, members of the public, staff, professionals, doesn't matter, were able to join and be involved with those conversations. Yeah, Jo, I don't know if there's anything you would like to add on the Zoom sessions.
No, I think there's still an ongoing need for these, and Clive's seeing that they're still incredibly busy, so they're well received. And there is some concern that some parts of the system perhaps aren't getting the support they might need, and therefore Mind is plugging a gap in different parts of the system. So I think that's something probably for us to have a conversation out in another place around it, but it is important because it's just what it shows is that even though lockdown's easing and things are changing, is that there's still a need for people to want to do this and to continue.
Most definitely. If we can move to the next slide, please. So I believe this is a breakdown of who's attended in terms of where they're coming from. And as we can see, it's actually good representation from across a range of places, with predominantly members of the public who have attended, which again emphasises what Jo's just said there, and also from the hospital. And it's been another opportunity to connect with people, reassure, and think about what is it we can be doing for ourselves as well as for others in terms of recognising when our own emotional well-being may be at risk, or if we start to experience stress levels that are becoming problematic, and what can we be doing sooner to manage that. Next slide, please. So we called this key learning points, but I guess really it's just messages. And from my perspective, although COVID-19 has obviously been such a negative experience, there has been positive things that have come as a result of it, in terms of the opportunities to work with others to create services in quick response to identifying immediate needs, in terms of things like setting up a bereavement offer so quickly as well, working with our voluntary sector, who have been instrumental in taking that forward. And as I said previously, recognizing that when it comes to mental health, there really, it has no discrimination. It is something that anyone is susceptible for, and it's something we all need to be aware of, all need to be ensure that we understand, identify, and know where to seek support, and that there is a range of help and support out there. And Jo, I don't know if there's any final words from your perspective.
No, that's fine. No, I think that's fine. Thank you.
Okay, thank you, Gordon and Jo, and thank you for stepping in. It's really unfortunate, isn't it? We know that from time to time we have these technical problems. I'm sorry to both Heather Ireland and to Jo Oliver that they weren't being able to share the passion and the learning and the opportunities they've provided for the people that have been supported. But thanks to them nonetheless for that work, and thank you for the presentation. I understand, Tanya, if you could introduce yourself, you'd like to come in.
Thanks, Chair. So it's Tanya Miles, AD for Adult Social Care and Housing. So just wow, fantastic report, fantastic energy, what partnership working. And it's great to see that this system in Shropshire has placed mental health at the front and centre of our response to the pandemic. I guess a lot has been said, and we've done so much about increasing ITU capacity and building new hospitals. But in this system, we have really recognised the impact of the lockdown on people's mental health. And I guess as we move out of COVID pandemic, we know that people will need more support from us than ever. In particular, our young people, people with bereavement, individuals who have been in ITU, recovering from COVID, staff on our front line. So just a huge thank you from me, and Andy would say the same, for all that you've done as a partnership in working together. And I guess a plea for us all to keep mental health on our radar. And then there's a couple of questions, if I may, Chair, please. What particular support are we providing to our young people, parents and education establishments right now and over the next 8 weeks? I guess I'm thinking about our young people who are waiting for their GCSE results and A-levels. I know within Children's Social Care, Karen Bradshaw was on the call. She would raise a growing concern about the anxiety and stress levels in particular with the Year 11 cohort. And then my second question is regarding the Zoom session, so fantastic data there. Is that just for adult provider professionals and individuals, or is that all age, please? Thank you, Chair.
Do you want to come back with the answer to those, Jo, if you can?
Yeah. Well, if I perhaps, yeah, well, we can answer these Zoom sessions, yes, quite clearly, quite quickly. It is currently for adults. But I think, Tanya, that point's well made, really, because it is something that could be adapted for young people. And young people tend to use social platforms, and the Big White Wall is an example of a really modern way of reaching young people, and it's been shown to be really effective. So there's nothing to stop us trying to introduce Zoom sessions for young people if that's something that they would find valuable. Your point about the Year 11s and the ongoing anxiety, it is bothering us, and through the Task and Finish group this week, that was our #1 kind of discussion, really, about what could we do collectively to support young people. So there are some suggestions that are coming forward, and I know there's a parents helpline that's being set up in the council to support parents, but we feel there needs to be a double-pronged approach, really. We do need the schools to take a role in this, and possibly if a letter could go to parents but also to young people with some information in it about our local existing commission services, but some other things as well that young people in particular would find helpful. I personally believe we need to ask those young people what is it that they would find useful at this particular time, because we might just be guessing. And I think it's absolutely essential that we try and involve young people in that. But we would like to do more around this. We feel it's a particularly important time to support young people. It's the build up to an anniversary type thing when they have closure. We've suggested things such as school assemblies, virtual school assemblies, that schools could hold as a way of closure for them, and creating a kind of forum where they can come together. So we're certainly giving it a lot of thought, and would want that endorsement and support from the Health and Wellbeing Board, really, to be able to progress that.
Thank you, Joe. I've got some things I'd like to say myself, but I'd like to invite Rachel to come in. If you could just introduce yourself before you speak, Rachel.
Yes, it's Rachel Robinson, Director of Public Health. Again, I mean, Tanya put this really eloquently, I think, in terms of, thanks and just the amazing work that's been undertaken. I think as a board and and also as a public health team, we've highlighted mental health as one of our priorities, both before and also as well as during, and we know that going forward, this isn't going to go away. So I think that actually all of this fantastic work and getting on a front foot with this is exactly the direction we need to be going in, to make sure that the mental health work has the same parity as the kind of the physical health, if you like. So just, and a huge thanks to everybody who's been involved in this. Is some really great work, and I'm really excited about some of the work that's gone on, the programmes that have been described, and going forward the big white wall, which we'd hoped to launch and hopefully have the Health and Wellbeing Board support to launch that collectively today, but because of changes in the name and launch, we're going to delay that. But I think it's really important. We really want to get behind that, and I think, as Joe said, the colleges and others have already got involved in some of these programmes in other areas and in Shropshire, and so I think it's a really good mechanism for getting some of our older young people, if you like. But absolutely, I think young people, and not just in terms of mental health, but generally in terms of the impact of COVID and the opportunity there, is something I think we really do need to explore and focus on. And there's some of the work that's coming out around kind of the kind of COVID work at the moment and patterns. Really keen that we engage with our young people and make sure that we've got an offer there around the kind of impact now, and also going forward. So just support that work, and we are looking at that and exploring that. But I think there's a lot more we can do around that, and again, to involve partners around that would be fantastic. It's really a comment, really.
Thank you, Rachel. Ed Potter would like to come in. Ed, if you could introduce yourself.
Hi, Ed Potter, portfolio holder for Children's Services. Just in relation to accessing and reaching out to young people, one of the things I think that's been apparent throughout the COVID-19 and schools being closed is reaching those most vulnerable, those that perhaps aren't on the radar. We know that certain families and certain young people haven't been actively engaging with schools, and I am conscious with the school holiday period fast approaching, how we can sort of improve our access to reach all young people through as many different channels as possible, because I don't think some of those perhaps that are most vulnerable will be actively engaged with schools, and likewise with families as well. So that's just something I wanted to flag, to see which ways we can sort of broaden the reach to get eyes on young people, basically.
Thank you, Ed. And Dean Carroll would like to come in. If you could introduce yourself.
Thank you, Chair. It's Councillor Dean Carroll, portfolio holder for social care, public health and climate change. I'd just like to endorse everything that's been said, to be honest, by colleagues about the great work that's been done. I think Gordon and Joe and the partners have done fantastic job, and hopefully we can keep up the momentum.
Thank you, Dean. Jackie, you'd like to come in. If you could introduce yourself, please.
Hi, Jackie Jeffrey, voluntary sector rep. I'd just like to endorse what was happening about the mental health and saying how brilliant it is. And also we use the big white wall within my own organisation, and it's a great resource. But as far as kind of mental health and going forward, please keep that up and make it more available. I'm really glad that you've made Big White Wall is going to be available to residents. But what the feedback coming back from organisations like DWP, certainly across the Citizens Advice Network and across the voluntary sector network, is there's been a drop in clients coming to us with mental health issues, and predominantly we have a higher proportion of people presenting with mental health issues, and it's been a real suppressed group through COVID, and I'm really worried that there will be a bigger surge as we come out of lockdown. And my particular issue is around those who can't access digital channels too. And I just wanted to make that point, and yeah, need to continue, but I think there's going to be a bigger surge as more vulnerable people are starting to hit some really big issues.
Thank you, Jackie, for that. So from my perspective, I'd like to echo the thoughts of all of the contributors about the fantastic work. I've got a couple of specifics that I'd just like to briefly ask about. In the action plan, the Mental Health Resilience Action Plan on page 59, don't you just hate it when somebody quotes a page number? There's an entry about the mental health helpline available 24/7, which I think is the Mental Health Trust's helpline, and it says that one of the issues with it is uncertainty as to its purpose, and that is a particular issue. Could Gordon or Joe perhaps clarify what do we mean by that, and is there something we should be doing about it?
Yeah. Hi, it's Gordon here. So it is the Mental Health Trust 24/7 helpline, and yeah, as it name implies, it is for anyone that does have a mental health concern about themselves or someone else to get to speak to someone and be connected to the most appropriate support. My understanding in terms of where there may be some uncertainty is we've been speaking with the CCG as to getting some communication sent out across to the primary care networks and other services as well, which just provides a little bit more detail as to why this has been set up. It is something that was planned, I believe, for the future, but has been brought forward because of current circumstances. So there will be some communications that are sent out, which does provide a little bit more detail.
Okay, thank you, Gordon. And then I suppose there's a couple of the other thing from my perspective. We, as a health and wellbeing board, we've spoken at length on a number of occasions in the past about low-level interventions of mental health support. And what I think is fantastic and really encouraging about this work that's come about, regrettably, as a result of a pandemic, but nevertheless is really starting, as far as I can see, to look much more closely at what can be provided without recourse to a formal mental health pathway. And so those informal resources and those low-level opportunities across the whole of the Shropshire population to access these, I think, is absolutely to be welcomed. I think the booklet, looking after your mental health during COVID-19, is fantastic. Have we thought about recovery? Because during COVID-19, we're recovering from COVID-19. Is there any scope to look at perhaps relaunching that as we recover out of COVID-19 and perhaps altering slightly some of the nature of the document, because it very much talks about lockdown and things to do, jigsaws and that sort of stuff. And I think that it would be really helpful, and I particularly welcome the fact that we produce printed copies. So I think from my perspective, I'd like to push that ambition, if that could be looked at. I I've already said that it was a pity that we couldn't have had Joe Oliver and Heather Ireland to present, but we have Jackie here who's contributed, and I just wanted to reflect that Shropshire Council has now formed 2 strategic fora to specifically look at economic and social recovery post-pandemic. And I think that we have an opportunity, because of the engagement from the education sector within that forum, to pursue some of the ambitions that Joe Robbins talked about in terms of the virtual assemblies and some of that work in schools. So I think it would be helpful, perhaps, Joe, if you've got some of those ideas around what we could be saying to the education sector, then perhaps we might take the opportunity to have you as an agenda item at the COVID-19 Recovery Social Task Force. So I think that, from my perspective, would be a way that I could enable some of those strands to be drawn together. My only other concern is that post-pandemic, if we're going to be able to continue to make resources available, we've heard about the pressures in the acute, 85 to 90% of the level of admissions into the acute versus pre-COVID. We've heard about how busy primary care is. There's obviously now going to be a rising pressure on budgets. Are we confident that we're going to be able to measure the outcomes that will result from these lower level interventions, so that we can demonstrate the need to continue to fund these? And I suppose, far be it from me to be pessimistic about the money, but it doesn't grow on trees, and we do really need to think about how we continue to evidence both the changing need, but also the results of some of these fantastic interventions, so that we can evidence the need for them to be continually resourced.
Shall I come in with about the children's, Gordon? I think within the children's projects, Lee, the Leeds University, if we're successful with that, will give us a baseline survey that we can use year on year to monitor the impact of interventions. And the 2 interventions that we're specifically looking at as part of the research would be around mental health and support for schools, but also the impact of nutrition through the provision of some free breakfasts. So that would be something that could be measured. The children, young people, social prescribing could be measured. We know from the adult model that we're able to demonstrate outcomes and outputs from that, and we would be able to do the same for the children's. I think what we haven't been able to show today, because things have only been in place perhaps 4 months, is the ongoing impact of that. But in every single project we've developed, probably with the exception of the leaflets and the booklets, because that's quite difficult, we've built in outputs and outcomes. So the bereavement project, we haven't been able to talk much to you today in detail about that, but we've put in outputs and outcomes from that, and a monitoring framework, so that we get the referral numbers and the outcomes from that and can review as we progress. Don't know if there's anything you want to add, Gordon.
Excellent. That's superb. Thank you, Joe. I'm conscious of the time. I wanted to make sure that we gave that item the airing that it deserved. But what I'd like to do, I think, is if there are no more speakers, I'd like to just confirm that the recommendation from the board is that we're asked to be aware and recognise the range of activities that have been able to be progressed in a short period of time, and to consider whether there are any other opportunities that could be explored supporting the mental health and well-being of our residents. And I think, in the absence of any naysayers or messages from other members of the board, I'm confident that as a board we will accept that recommendation and work towards that. The final item is the COVID-19 and local outbreak control plan. And if I could introduce Rachel Robinson to take that for us.
Okay, thank you very much. So this presentation, as I said, is effectively to through the Health and Wellbeing Board to launch publicly our local outbreak control plan. But before I went into that, I felt that it was a good opportunity and to have a reflection on where we've been over the last 125 days. So if we can just, sorry, click on to the next slide. The 125 days is actually the time since the last Health and Wellbeing Board. And when I was going through the notes of the last Health and Wellbeing Board, I think as colleagues have already alluded to, it was a very different time. I think at that point we had no cases of COVID in the West Midlands. Obviously a really difficult time. We just stood up our LHRP arrangements, which has become silver and gold in the NHS. And obviously, and I was having daily meetings internally around COVID, but certainly the scale and the impact that this has had is only had not at that point reached us, I guess it's fair to say. And to date in Shropshire, as you will know, the number of cases of COVID, we have today had 1,397 cases across Shropshire. And we've recorded, as colleagues have said, up until the end of last week, 246 deaths in our community and across our care homes and communities and hospital sectors. And I think everybody's already, taken a moment to think about that and to remember. And I think it is really important that we do remember every single one of those cases and every single life that's been affected by this. And I think the other thing, obviously, is this is, has the impact that it's had on every single one of us. So I think what a difference 125 days makes for everybody. So it's just a moment to pause on that. Next slide, please. Can we move on? Can we move on to the next? Thank you, thanks. So this is just to summarise. I just wanted to give an overview. Many of you will have seen this, but this is the pattern of the cases across England across these past 4 months, and then the cases within Shropshire. So you can see in the top corner, that is the sort of epidemic curve of cases across England, and then the bottom curve is Shropshire. And it's just to flag up that, which I flagged, continue to flag, is that the pattern in Shropshire has been flatter. The peaks, we have had peaks, but they have been less, but they've come later. But also our slowdown, and that tail has also been slower to decline and is flatter within Shropshire. So a note of caution that I would apply is that as we move on and as we come to this next phase of the pandemic, moving to outbreaks, as colleagues have said, we move on from talking about this being a pandemic across the country to talk about localised outbreaks. We do still have cases in our community. The numbers are smaller, but that risk is still out there. So we still need to make sure that we implement the guidance and follow those messages that are out there, and I'll come on to that. So I just wanted to mention that and flag that for colleagues. Next slide, please. And so this slide just highlights that further. You can just see the pattern in England. We use something called the 7-day rate, which is per 100,000 population. And on this slide, it just tries to illustrate the trend. And these will be made available on the website so that colleagues who aren't able to see these can see these slides. And you'll see that the pattern in England and Telford in Shropshire is slightly different, and it illustrates the point I've already made. The rate in Shropshire it still remains above the England average slightly. It is coming down, but we do need to keep a close eye on that, and we are keeping a close eye on that. Next slide, please. And this slide just shows the deaths across the local area in hospitals, and again shows that peak and then that tail within Shropshire. If I move on to the next slide, please. So for me, just some key messages and reflections before I talk about the local outbreak plan. As I've said, the epidemic curve and the profile of cases in Shropshire is different to the national. It's been delayed, it's been flatter, and it's been longer. The overall picture is certainly an improved one, and we are seeing that slow downward trend. I think it's fair to say, and I've said already, that nobody's been untouched by this, and I think the response and that everybody's talked about across this and the collaboration has been phenomenal. Just to flag that point that I've already made around that ongoing circulation, we do expect to get local outbreaks. That will happen as the numbers come down, and that is why we're set up with our local outbreak plan, which I'll come on to describe. And we do need to prepare for a potential second peak, and again, I'll come on to that. So that's all I want to say on that slide. I think I'll just pause a minute because I think somebody wants to come in before I move on to my next slide.
Yes, Dean, I understand would like to come in. If you could introduce yourself, please, Dean.
Thank you, Chair. I was actually hoping to come in at the end of Rachel's presentation, so if she wants to carry on.
I'll carry on then.
Perfect. So,
okay.
Rachel, before you carry on, thank you, Dean. I've got a question. On the last item on that slide there, you're talking about an increased number of outbreaks in workplace settings. Could you explain? Does that mean that people are infecting each other in a workplace, and does that therefore point to issues with workplace practices, or is this more related to the way that workplaces are monitoring their workforce?
Absolutely. So with workplaces, obviously, if we have an outbreak in any